Guys, time is the only resource that we can't get more of. And I want to commit as much time as possible to putting out content that helps more people just like you. The only way that I can do that is if you like, comment, and subscribe to this video. Please give me feedback and help me help you. I think you have better instincts in this way on how to be objectionable but not too. Some of you guys are like, you're either impossible to close or like you're like, hey, I got a lot of money. I want you to roll into a annuity. So you can be Janie.
I'll be Janie, Miss Janie.
And you're turning 65. And I'm calling you because you had stumbled across our website and downloaded our lead magnet. So
Okay.
ring, ring, ring. Ring, 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 ring.
I thought I was calling you.
No, I'm calling you. Ring,
Oh.
ring, ring. Hello? Hey, Janie, this is Justin Brock with Medicare Gurus. I saw that you were on our website and you were going over our 7 steps guide. I just wanted to reach out and let you know that we're here to answer any questions you have. Now, you're going on Medicare in June, is that right?
Who is this?
This is Justin Brock with Medicare Gurus. You were just on our website. You're probably still looking at that pamphlet. You were on there about 5 minutes ago. If you're not, we can definitely help you pull that up. Did you get in there and read through it yet?
I got it. I hadn't read it yet.
Okay, well, I'm here to help you go over that thing because some of these things can get confusing, as I'm sure you've already figured out. Now, this Medicare guide that we put out has 7 steps. It goes over the 7 costly mistakes. The good news is if you're working with us, you typically don't make any of those mistakes because we kind of guide you the right way from the get-go. Now, you're turning 65 June 21st, so your birthday was June 21st, 1956, right?
Yes.
Okay, all right. And have you talked to anybody else about your Medicare yet?
I've had people calling me, and I called one of them letters I got in the mail, but I didn't like the way that guy sound.
Okay, and do you have any other health coverage right now?
I don't.
Okay, and so you just been going without any coverage and waiting for Medicare?
That's right. I've been fingers crossed.
Okay, well, good news is with Medicare here, you're not going to have to worry about that anymore. We can get you on really good coverage. It's very affordable, which before you were on Medicare, I'm sure was hard to find, right?
That's right.
Okay, well, let's look at the different plans. Now, when you look at Medicare, there's typically 2 paths that people take. Now, do you have a notebook somewhere?
You're going to have to give me a minute. I do.
Okay, get a notebook and a pen because
Okay,
I want you to take some notes.
I got it.
Okay, all right. Now, draw a line right down the middle of that piece of paper in front of you.
Like off center or right in the middle?
Right in the middle.
Okay.
Right down the middle, smack dab.
All
Okay.
right. I got
Now,
it.
at the top of one side, I want you to write Medicare Advantage.
What's the advantage to that?
That's just what they call it, you know. Some people would say there is an advantage, and some people say it could be called Medicare Disadvantage, but we're going to look at it and decide what's right for you.
Okay.
Now, on the other side, I want you to write Medicare plus Medigap.
Okay, I got it.
Okay. Now, when you go on Medicare, you have 2 options here. One would be to take a private plan, which they refer to as Medicare Advantage, and that Medicare Advantage plan would actually do the work of Medicare and kind of your supplements and things like that together, but it doesn't necessarily do the same job that Medicare with a supplement would do, which I'm going to get back to. The other path is you keep your red, white, and blue Medicare card, and so the government's version of Medicare remains your primary coverage, and you get a supplement and a drug plan to go with it, okay? So one, like we're setting it up here, one is your private company is running everything. They're in charge of your claims and all of that. The other side, governmental Medicare that's ran by the Center for Medicare and Medicaid Services is in charge of your making the decisions on whether they'll cover something or not. Okay, that's the biggest difference, you know, at the basis of these 2. Now, if you stay on Medicare, you have deductibles, copays, and co-insurances. But if we put a Medicare supplement Plan G or Plan N in there with that, it's going to cover up almost all of the deductibles and co-insurances. As a matter of fact, with the Plan G, the only out-of-pocket you'd have each year is a $203 calendar year deductible called the Part B deductible. That's all you would be responsible for. Then you would have a drug plan as well, which we would pick based off of what prescriptions you're taking. Now, are you taking any prescriptions?
About 4 or 5.
Okay. Now, are any of them real expensive right now? I'm assuming with no health coverage, you've just been going to the pharmacy and getting them with cash?
Yeah, they're all pretty cheap.
Okay, well, that's good. Now, on the Medicare Advantage side, we go that route. We would have the benefit to it is going to be, or the advantage to it would be, the premiums are lower, and it still has a cap on your out-of-pocket potential. But with it, you do have some co-pays, and if something really big happens, you do have a little bit higher potential out of cost. Okay. Now that maximum out of pocket on there is going to be somewhere around $6,400, $6,400. Whereas on the Medicare side with the supplement or the Medigap plan, that out of pocket's going to be that $203 there. Okay.
I couldn't afford that.
Okay, all right. Now, as far as monthly costs, right now you're not paying anything, which leads me to believe you might have looked into it and maybe the Cobra was real expensive or something like that. So what we're going to look at is see what the cost of a supplement would be and see if that's affordable for you, okay?
Okay.
So that Medicare with the supplement where you stay over there and you only have the $203 out of pocket, you would be looking at about a $102 a month plan there. And then if you're taking all generic drugs, what pharmacy do you go to?
CVS.
All right, we just looked up all your drugs, and it looks like the $7.30 Silver Script Smart Plan would be the way to go over there. So you're at about $109.30 a month. And how does that sound to you? Is that affordable?
I think I could do that.
Okay, all right. There's only 2 more things that we recommend. This is our next tier of coverage with that is we recommend getting a dental, vision, and hearing plan because Medicare itself doesn't cover dental, vision, and hearing. And so we get a separate one, and that plan is going to be about $50 a month to get the best one. That's going to be it's going to be about $3,000 worth of benefits each year for dental, vision, and hearing. And then we recommend an extra cancer policy that would have a $10,000 benefit, which is about $32 a month, because when you have a cancer diagnosis, you would have to pay some. You might have to pay some extra expenses outside of what Medicare approves, as well as some higher drug costs.
Well, I can tell you, I ain't gonna need that. I had cancer 15 years ago.
You had cancer 15 years ago, and so your belief is that because you had cancer, you got it out of the way now.
I'm done with it.
Okay, all right. Well, did you know that if you get cancer, it's actually more likely to come back? You know that? I'm sure they told you that, right?
Well, we keep an eye on it. I go at least twice a year.
Okay, do you have another cancer policy?
I do. I got an old one that Paul had from work.
Paul had from work. How much are you paying for that?
It's about $40 a month. We've had it for 20 years. I ain't touching it.
Okay, yeah, I wouldn't touch it. I'd leave that thing in force. We find that a lot of those older cancer policies have some great benefits, but they're designed to pay a different way. The one we're talking about really fills in the inadequacies in Medicare, and that's just that drug expense. The lump sum diagnosis benefit of $10,000 comes out, and you can use it to pay for those drugs up front. So that's one that we're going to recommend. And that all-in cost with dental, vision, and hearing, cancer, your supplement, and your drug plan is right around $200 a month. Does that sound good?
I don't want that dental and vision.
You don't want the
stuff.
dental and vision? Okay, well, without it, you're at about $150 a month. Do you ever go to the dentist?
No, I've got all these dentures in and just got a pair last year.
Okay, all right. Well, that makes sense then. You know, the only thing about this dental plan is it will pay in the future on the replacement or repair of your dentures. Is that something you'd be interested in having?
I really don't care about my teeth, but will it help my eyes?
It will. It will help your eyes, and it has a hearing aid benefit that's up to $3,000.
Okay, that sounds good.
Okay, well, let's keep that on there then in case you need it. And then if you did need it for teeth, it would be there. So that's going to be about $3,000 a year in benefit there for dental, vision, and hearing, and everything's about $200 a month. Okay, so we're going to start all this on June 1st. All I need you to do is get out your Medicare card so I can get that number off there and verify all of your Medicare eligibility.
I don't want to pay for nothing right now.
Well, we can make it all draft on the effective date, and so it won't actually come out until June 1st. How about that?
Okay. You need my credit card number?
So we're going to put the whole thing on bank draft, every bit of it, but it's going to come out on June 1st, and that's the best way to do it because we can have it come out right after your Social Security deposit so that you're never having to worry about your coverage lapsing and it not being there when you need it.
Yeah, if you don't do that, there ain't gonna be no money in there.
Well, that's how we're going to do it then. So pull that Medicare card out. I just want to verify that Part A and B effective date and the spelling of your name on there.
Okay, it's
All right, so
Lucille.
that's pretty much it right there. You know, I'm pretty rusty on it, honestly, but I think that that's a good way to do it. See, he was that's how to be my prospect. I had some objections, but nothing crazy like, well, I had cancer yesterday. Well, I can't get by that one.
I think the denture objection is a really good rebuttal.
Yeah, some objections to the dentures, you can still pivot around it, focus on the extra benefits. He actually set me up a little bit by saying, does it cover the eyes? I started to not even pivot and even offer it at that point, but normally you could say, well, now it's very good for vision and hearing as well, and if you needed it for the dental, it'd be there. So.